has to do, and you are the back room for all the little tiny things that have to come together to make this work.
That's exactly it. And it's not just the physician. The physician is on the front line, but his or her entire staff is part of that coordination of care. So from the receptionist to the front to the MA in the middle to the nurse in the back, everyone's got to work, on a streamlined basis to make sure that that patient gets what the doctor ordered.
You can answer this question for me, because when I watch TV, it seems as if every other commercial is a drug commercial. Now, my guess is because if one does it, the other one has to do it too. But two questions. Why are the pharmaceutical companies advertising so much to the public, A, and why are drugs so expensive these days?
Well, let me take the first one first. Why do they advertise so much? Well, there's a huge capital investment in these new pharma drugs. The cost is about $2 billion from R&D and FDA approvals to get from start to finish, and not everyone actually makes it from start to finish. So the ones that do make it, they need a splash. In terms of why the price of the drugs are going up, one is, like I just mentioned, the upfront cost and the investment, but there's a lot of untold stories about what really happens inside the insurance world. And the problematic thing for patients is that the retail or the MSRP price that they see and hear about these drugs is not really the real cost that's happening inside of the system. And so it's very convoluted, it's very complex, but part of that churn is driving up drug prices, and that's bad for patients.
Now, I think you answered this question a little bit just a few moments ago, but how are you dealing with the competition? You mentioned customer service. Is that the secret sauce?
I would say that customer service and building real relationships is the secret sauce. People think about sales forces and you're just going and selling. Our sales force is really a service organization. We support a lot of physicians, but by supporting them, we are there for them day after day, week after week, and we built a technology and a people infrastructure that can handle all that volume and do it consistently. I think the second thing is that we didn't come from the pharmacy industry. Senderra's been around for 7 years, and I've got 8 years of experience. And we've been fortunate that we can hire some people now that have more experience than we do. But being innovative and turning the dial 15 degrees and saying, well, what if we did it this way? Why do we always have to do it the way that everyone else did it? I think has been very helpful to our growth.
You're not locked into those preconceived conceptions that a lot of your competitors have. Drugs are going to be more expensive. You mentioned that you're over $700 million, but a lot of that is the cost of the drugs. What are you going to do as a company, Senderra, to meet expected future growth?
The first thing is that we only get into drugs and disease states where we think we can be best in class. And so maintaining a real laser-like focus is really important. There's 300 drugs on the market today serving about 20 different kind of what we call disease states. But there's over 3,000 in the pipeline. And so more and more specialty drugs are going to be offered towards chronic diseases that they currently aren't offered today. So we believe in being best in class. And so as opportunities come to be best in class, those are the new markets that we're going to go into. The second thing is that by establishing a national platform and taking care of all these patients really inside of maybe 15 to 20 drugs, we built great relationships with pharma companies. And so as they become innovative and launch drugs in new spaces, they're pulling us along and saying, if you could do this for RA or for derm, we think you can do it for Hep C or for MS. And so, the full name of Senderra is Senderra RX Partners. We partner with our physicians, we partner with our own people, and we partner with our pharma partners. And by doing that and communicating well and listening and being able to really be learners, it's amazing how many opportunities that you find when you just slow down and you listen.
You mentioned relationships a little while ago, And that was the word that came to mind before you said it was partnerships. You're actively becoming involved with their company. As they're doing the research, you're helping them understand what they need to do. Is that correct?
Research is already done before we get involved, but probably 6 months before they launch the drug, they need an execution strategy. And so they're bringing a new product to market, and if it fits inside of our doctor network, we can assist them in saying, hey, we've already worked with this drug company. They've got a new program. They've got a new drug, and we can tell all of our physicians, if you think it's the clinically best thing to do to write this product for your patient, we're already ready to go from a process standpoint to handle it.
So because the physicians you're working with, once you suggest and offer this to physicians, they trust you enough to go along with your suggestions.
We're only as good as yesterday.
We've been talking about your success over the last 7 years. Obstacles. What's been your biggest obstacle you had to run into as you develop Senderra RX Partners to become successful?
Well, we've made a lot of mistakes. And, when you're an entrepreneur, you've got to be able to be willing to make mistakes and actually create a culture where it's okay to make mistakes, to think outside the box. Just don't make them twice. Don't make the same one twice, right? I think being adaptive to the marketplace has been really helpful. I think having a tailwind with an expanding market, that's been really helpful. So even in the midst of our mistakes, we still had a bunch of organic growth opportunities to kind of outweigh those mistakes. And then I think that the third thing is being willing to partner, being willing to listen. I think everyone has this fixed box that they think that the world has to fit inside. And when you're new to an industry and you're trying to grow something, then I think that you're a lot more open sometimes to think outside the box and to do stuff that is outside the norm.
This is Playmakers Talk Show, and by the way, we're speaking with Will Howard. Will is president of Senderra RX Partners. Their website is senderrarx.com. And as a playmaker, playmakers make mistakes. They realize there's obstacles. As you said, you just don't want to make that mistake a second time. You're going to make more and more mistakes in the future. But you mentioned something before the show started. This is a little bit about your leadership style and some of the mentors you have, but you're doing a lot for your people. Tell us what you're doing for them and why you're doing that.
Our mission statement is that we believe that patients are people, and that's why every day we deliver the care and the technology to improve people's lives. That's a big statement, and nothing in that statement says anything about being a specialty pharmacy. In order to live up to that, we've got to instill that culture and that belief in every single person who works for Senderra. And so we do a couple things. One is that every new employee goes through a 12-hour class that we call the Senderra Leadership Institute, and it teaches them core values. It teaches them better communication styles and techniques, but it teaches them about what a purpose statement really is and what is their own purpose statement. And we believe that if you invest in your people to where they feel safe and motivated and inspired, that's going to translate to outstanding customer service on the back end. And so it's really about investing in our people, showing them that we don't make widgets. We're not making iPhones here. We have the opportunity to help thousands of people every single day. And it doesn't matter if you're a pharmacist and you're doing the really complicated stuff, or if you're a call center person, or if you're just managing the fax machine. Every single one of those jobs is critical to making the whole process work. And all 300 people are actively working on the benefit of a patient, on a personal basis. And so what a great opportunity.
Well, correct me if I'm wrong, you're not touching anything. You have no assets. You're the middleman in between. And all you're selling is your service.
Exactly.
How you take care of your customers.
We temporarily take control of some inventory, but from a fixed asset basis, it's more personal capital or people capital than anything else.
Again, before the show started, we talked about some of the mentors you have as a result of going through being a graduate of SMU. But can you think of the best advice you ever received, either from one of the mentors you met as a result of SMU or in life? Any great advice you received that has helped you as you put together Senderra and become successful?
Well, there's been a lot. But just off the top of my head, we've talked about making mistakes earlier, right? And we see, especially in our market, we see a lot of hard and fast companies who create a culture where if you make a mistake, then you're gone. And when you're building companies, you have to understand that mistakes are going to be made. And so how do you create a culture where it's okay to think outside the box, and it's okay to take risk, but to also take good risk too, And so I think that's been something that we've learned. The other thing is that when you're starting a new company, you've got to be supremely optimistic, but you also have to be realistic. And a funny way of saying that is that your baby might be ugly today. It's okay to call it ugly, but to always have hope and to believe it's going to get better. And I think that's what builds the long-term nature to stick with it and to keep going and to keep pressing the envelope. And just know that good things are going to happen if you bring together good people and good ideas and good culture, and hopefully you have a good business plan to go along with that.
And you continue to develop them as you are.
Yes.
I believe I'm going to mess up the quotation from Oscar Wilde, but I think is that the greatest idea is an idea whose time has come. And apparently there's a need in the marketplace as you put this together. How did you see that originally? What was the aha thought that you thought to yourself, we need to do something to help patients and physicians with drugs?
It really started before we started the company. We, through Tom's relationships, we had the opportunity to meet with 3 really large practices here in Dallas, with either the physicians or their office administrators, and we workshopped an idea, and we came back 3 or 4 times. And about the 4th or the 5th time, each one of them said, if you do this, then you can have all of our patients, because this is such a game changer. And really that's been the fuel that has fueled the growth, because this need is not a Dallas, Texas need. It's not a Texas need. It is a universal need across all physicians. And it's not just in the services. It's that people want to be treated like people. I mean, that's how this country grew up. I'm somewhat on the younger side, but I've got great parents and I've had great grandparents who've shown me what that really looks like. And so if you're willing to treat people the right way and to forego quick profits and efficiency by building something bigger and better and more sustainable, then it's amazing what you can build sometimes.
And I'll say that that's actually the future of any successful business from here on out. Let me ask this question. Could a patient go to your website and suggest it to their physician?
Absolutely. Yes.
Then tell everybody where they can find out more about Senderra.
Well, the first thing that you can do is you can go to our website and you can just show our doctor the forms that we have and the disease states that we manage. And hopefully he's already heard of us, though.
Well, that's SenderraRx.com. Will, thank you very much for being a part of Playmakers Talk Show.
Thank you for having me. Appreciate it.
You are definitely a playmaker with what you've done with Senderra. Will Howard's been our guest. He is president and founder of Senderra. This has been a terrific show. It's been great having Will with us. Thank you to all of you for listening to us. Join us again at PlaymakersTalkShow.com. We get all of our past episodes. That's PlaymakersTalkShow.com, and we're going to be back with more Playmakers. See you then.
You've been listening to Playmakers Talk Show with Steve Klein. Join Steve again at PlaymakersTalkShow.com for more interviews with interesting and successful playmaking CEOs and executives.